Having already explored narrative therapists' views on normal family development and on how behavioral problems develop, we will now consider conditions for behavioral change and also look at the therapeutic assessment for narrative therapy and also the different techniques that are used within narrative therapy. The first concept that we need to consider in terms of narrative therapy's conditions for behavioral change is that of deconstruction. If we consider deconstruction, here the narrative therapist would view the problem as an external entity so that you can begin by start to challenging its influence. Another condition for behavioral change from the narrative therapy perspective is that of unique outcomes. This considers resistance to the problem's influence and also opens room for counter stories, which can also be known as counter plots. Another condition for behavioral change is that of shifting family members' views of each other from totalizing views that lead to polarization and antagonism. If we consider the assessment process in terms of therapy from the narrative therapy perspective, as a narrative therapist, one would begin assessment by first of all obtaining the family story. Here, you would get information about their family's experience as well as their assumptions about the problem. Once you have obtained this, you would then move on to mapping the influence of the problem on the family as well as mapping the influence of the family over the problem. You will then move your clients towards knowing that they already have had some power over their problems. If we now place our focus onto therapeutic techniques, in narrative therapy, interventions are done in the form of questions. Here one would pay special attention to both talents and strengths. A key concept that we have already discussed is that of deconstruction. And here the therapist would ask clients to first of all tell their problem-saturated story and assist them by asking questions that externalize their problem. There are a number of different types of questions that a therapist could use in terms of narrative therapy. Here we're just going to briefly outline what the questions are and what their function is. And in order to get examples of these questions, you can refer to your reading in Nichols. First of all, we will consider relative influence questions. And these are questions that look at how the problem has disrupted or dominated the family. There are also opening space questions, and these are questions that assist in uncovering unique outcomes. Preference questions, on the other hand, make sure that unique outcomes represent preferred outcomes. Story development questions. These develop stories from the underpinnings of preferred unique outcomes. Meaning questions. These challenge negative images of self and emphasize positive agency. And lastly, there are questions that are used to extend the problem into the future, and these help to support changes as well as reinforce positive developments.